Hi everyone, I'm Mark Stanford, Associate Professor in Psychology and Human Services at Cabrillo College, and I wanted to give you a little bit of information about the spring semester course called HSERV 162, the Physiology and Pharmacology of Substance-Related Addiction and Co-occurring Disorders. A fascinating course to teach, and I've designed it so that it fits perfectly well into the learning style of what we call asynchronous distance learning, which simply means there's no in-person classes. Every week I will post learning modules, and you go through them at your own pace as long as they're done by Friday of the Monday I post the learning modules. And the participants, students, will have access to me for one-on-one appointments and coaching, usually within 48 hours request, most times a lot sooner than that. And important to remind folks that HSERV 162 is really for all healthcare professionals at any level. And for those of you going into a career of addictions treatment and recovery, HSERV 162 satisfies CCAP and CADI education requirements in the category of pharmacology and physiology. So, a couple of questions. Have you ever wondered, how do drugs affect brain and behavior? It may not be what you thought. And what makes a drug addictive? And for that matter, what is addiction? And why do some drugs have an abuse potential and others don't? Or why is fentanyl dangerous and potentially deadly? What's the biobehavioral basis for drug addiction and psychiatric disorders? Is treatment for substance use and mental health disorders effective, and how do we know? And finally, what does evidence-based treatment actually mean? So this course explores the fascinating science behind the understanding and treatment of substance-related addiction and co-occurring disorders. So together we'll explore the neurochemical, biophysical, and mental effects of commonly used psychoactive drugs. And by psychoactive drugs, I mean those compounds that change the way you think, feel, and move. And an emphasis is placed on the basic pharmacology of psychoactive drugs, the medical consequences of repeat compulsive use, and evidence-based therapeutic approaches for treating substance use and co-occurring disorders. We also explore medications of significance in treating several categories of psychiatric illness, including anxiety, depression, bipolar, and schizophrenia. This is our text, the Julian's Primer of Drug Addiction, 14th edition. Really important to get the 14th edition, not an earlier version, because it could affect your test scores. And what science tells us about addiction is very important. A lot of times people are in the field of behavioral counseling and haven't kept up on the science, which can have a radical change on how you approach your patients. And so the onset of addiction often begins with the voluntary act of taking a drug, and continued use can change to involuntary compulsive drug use. And this compulsion results from a combination of biopsychosocial factors, including the dramatic changes in brain function. And so I posted this issue of National Geographic was dedicated in 2017, a couple of years ago, on the science of addiction. And so it was fascinating stuff. I was impressed by the current information, research-based, of addiction science that National Geo put out. So the information's all around us. Unfortunately, many times is not in the clinics where that information is critically needed. But really, just in the last 10 or so years, advances in our understanding the science of addiction has revolutionized our fundamental views of substance use disorders. And from that has resulted in vastly improved evidence-based treatments that helps people obtain and sustain recovery. Pharmacology, basically, is the science of understanding how drugs act on the body and, conversely, how the body acts on drugs. And pharmacology focuses on how a drug gets into the body, where in the body the drug acts, and how the drug is eliminated from the body ultimately. That's called pharmacokinetics. Big word, simple meaning. how a drug gets into the body, moves around in the body, and is eliminated. Psychopharmacology, which is the primary focus of this course, is the study of how psychoactive drugs, including psych meds, affect human behavior in a therapeutic way, and or in a dangerous and destructive way. I might be a little bit biased, but I think this is perhaps one of the most fascinating and informative courses offered at Cabrillo. So whether you're preparing for CCAP or CADI certification, need CEUs, or just want a refresher course on addiction science, or just simply interested in this topic, come on and check out this remote course of HSERV 162 at Cabrillo College. Enroll early at the website you see here and get access to some of the materials. So class does start soon, so enroll early and get access, and I really hope to see you there. Thanks.